Vince GT Centino from BP 3A and Group 3, Capital Punishment, Abortion, Mutilation, Sexual Perversions. Capital Punishment. Capital punishment, which is also known as the death penalty, is criminal punishment that takes the defendant's life as the punishment for the defendant's crime. The sentence ordering capital punishment is called the death sentence, and the act of carrying out the sentence is called an execution. Capital punishment execution of an offender sentenced to death after conviction by a court of a law of a criminal. Methods used around the world. Execution include hanging, shooting, beheading, stoning, crucifixion, gas application, electrocution, and lethal injection. There are ethical concerns about its effectiveness as a deterrent potential for executing innocent individuals due to flaws in the justice system and moral objectives regarding taking a human life even in the context of punishment. Next is abortion. Abortion is the termination of a pregnancy by removal or expulsion of an embryo or fetus. An abortion that occurs without intervention is known as the miscarriage or spontaneous abortion. These occur in approximately 30% to 40% of all pregnancies. Abortions can be categorized into several types based on the gestational stage and the method used. Common types include medical abortion or abortion pill. So, it involves taking medication to terminate an early pregnancy up to 10 weeks by blocking hormones necessary for pregnancy to continue. Number 2, surgical abortion. This can be further divided into different procedures based on gestational age. First, vacuum aspiration. Typically performed in the first trimester, it involves suction to remove the pregnancy tissue. Dilatation and curettage, similar to vacuum aspiration but uses scraping tools. Next is dilation and evacuation. Usually performed in the second trimester, involves dilation of the cervix and removal of the fetus using surgical tools. So the choice of method often depends on the stage of pregnancy and woman's health consideration, guided by medical professionals and local regulations. The topic of abortion is deeply nuanced and invokes varied perspectives, include ethical, legal, medical, and societal considerations. It involves complex discussion about women's rights, reproductive health, fetal rights, and broader social implications. Access to safe and legal abortion services remains a crucial aspect of healthcare for many individuals worldwide. Addressing this issue requires sensitivity, empathy, and a holistic approach that considers diverse viewpoints while prioritizing the well-being and autonomy of individuals involved. Next is mutilation. Mutilation refers to the severe alteration or disfigurement of a body associated with intentional harm or damage. Reports on mutilation can encompass various contexts such as cultural practices, criminal acts, or self-inflicted injuries. These reports might delve into the causes, consequences, legal implications, and interventions related to mutilation, aiming to raise awareness, prevent harm, and provide support or treatment for affected individuals. Mutilation can manifest in different forms, each with distinct characteristics. First, female genital mutilation involves altering or injuring female genital organs for non-medical reasons. So it's often a cultural practice, and there are various degrees of severity from partial to total removal of external genitalia. Second, self-mutilation or self-harm includes intentional injury to one's body without suicidal intent. As a coping mechanism for emotional distress, common methods include cutting, burning, or hitting oneself. So next is acid attacks. Involves throwing acid onto someone, causing severe burns and disfigurement, usually as a form of revenge, punishment, or control. Next, amputation mutilation involves the intentional removal of the body parts, whether as a form of punishment, ritual, or self-infliction. Number 5, tongue splitting air or air gouging. Non-traditional body modifications that involve splitting the tongue or stretching air lobes. For aesthetic reasons, but considered forms of mutilation by some. Each type carries unique cultural, psychological, legal, and medical implications. Next is sexual perversions. Sexual perversity has traditionally been defined in terms of violating externally imposed criteria for natural or normal sex. The theory proposed her views sexual desires in terms of their own internal structure such that diverse are those which are self-defeating because they are contradictory. Yes, there's a wide range of behaviors that may be considered as sexual deviation or perversions. These include, first, paraphilias. These involve a typical sexual interest or preferences such as exhibitionism, voyeurism, fetishism, or sadomasochism. Second, pedophilia, an extraction to prepubescent children. Next is necrophilia, sexual attraction or activity involving corpses. Fourth, bestiality or zoophilia, sexual interaction with animals. Fifth, frotteurism, gaining sexual pleasure from rubbing against unsuspected or non-consenting individuals. Last is masochism and sadism, deriving pleasure from receiving pain, or masochism or inflicting pain, sadism. These behaviors are considered atypical or outside societal norms and may have legal, ethical, and psychological implications. Understanding these behaviors involve complex discussion within the context. Avoidance or mitigation of these practices involves diverse approaches. First, capital punishment. Many advocate for abolishing capital punishment due to concerns about its irreversible nature, potential for wrongful conviction, and ethical consideration. Focus shifts toward alternating synthesis, rehabilitation, and addressing root causes of crime to reduce reliance, re, reliance on the death penalty. 2. Abortion. Efforts to prevent unplanned pregnancies through comprehensive sex education, increase access to contraception, and support healthcare services aim to reduce the needs for abortions. Promoting reproductive health, addressing social determinants of health, and fostering supportive environments for parenthood offer alternatives. Number 3, mutilation. Preventing mutilation involves education, awareness campaigns, and legislative measures to prohibit harmful practices, promoting cultural understanding, providing support for mental health, and offering alternative rites or ceremonies without harmful practices are key strategies. 4. Sexual perversions, creating awareness about healthy sexual behaviors, consent, and respect within relationship is crucial. Education that first fosters understanding and tolerance while emphasizing consent and mutual respect can be contribute to healthier expressions of sexuality, reducing the prevalence of harmful sexual behaviors. So that's all for my report. Thank you and God bless.